Tonight, the Valley's only epidemiologist says COVID infections are on the rise, affecting all ages. The percent positivity has more than doubled in the last few weeks. I spoke in depth with Dr. Patricia Cummings from Eisenhower Health. Dr. Cummings, you are the Valley's only epidemiologist. What can you tell us about some of the trends we're seeing right now with Omicron?
Hi, Peter. Thank you for having me. Right now, what we're seeing across the Valley and at Eisenhower specifically are increasing trends in cases among, all ages. But what we're really seeing is that increase in percent positivity. So about 2 weeks ago, we were at about 5%, and now we're at 11% positivity. And what that means is how many cases are testing positive with the COVID virus. What we have seen for the past 2 months, however, is really a stable trend in our hospitalizations. So we're seeing anywhere from 20 to 25 people in the hospital. And so what that tells us is that the vaccine is working. So among those who are vaccinated, we're seeing a very steady rate of hospitalizations and deaths. But what we're seeing is an increase or a surge among the unvaccinated. So a majority of those in the hospital are unvaccinated, and a majority of those dying are unvaccinated.
How concerned are you right now about Omicron, and do you expect that there will be a surge?
Omicron, yes, I do. Omicron is concerning from a public health standpoint because we are seeing increases in this variant in terms of a reduction in the vaccine effectiveness. So we are seeing that the mRNA vaccines from early data outside of South Africa and the UK, that they are still protecting a majority of people from hospitalizations. So in terms of disease severity, the vaccines are still very effective for a majority of people, but we are seeing a little bit of a decreased effectiveness in those. And so that's concerning from a public health standpoint. So as an epidemiologist, what we're doing is we're tracking very closely through COVIDnet, which is the state's public health laboratory data. They do a lot of the genomic sequencing. And so we're looking at that very closely to monitor trends and of course, monitor any cases that we're seeing here in the Coachella Valley.
What are some of the latest findings with Omicron? There's been a lot of information coming out, some saying that it's more contagious, but also less severe.
Right. So in terms of disease severity, we'll be very lucky if it's, a little bit more mild than Delta. If it's more mild, less mild than Delta, but it's 2 to 3 times more transmissible, then our hospitals could be very stretched very thin. So what we are seeing in the early data is that it is a bit more mild, and that could be a reflection of, a majority of the population being vaccinated. Maybe that's why it's presenting as a more mild illness. But what we are seeing is the increased transmission. And so that's very concerning because, we're going to have that steep curve take off in terms of spread.
As an epidemiologist, do you anticipate that we're going to see more variants of COVID? And what are your predictions for 2022?
Yes, as long as a majority of the population is unvaccinated, as long as we have a percentage of the population that is not vaccinated, we're going to continue to see variants emerge. And so we really want to be encouraging people to get vaccinated. Everyone age 5 years and older is eligible for a vaccine and should be getting vaccinated. Those who are eligible for a booster, so those who are 16 years of age and older, please get your booster shot. Increased use of masking indoors is going to help protect you during the holidays. Improved ventilation. So if you can open a window, open your doors, or even eating outside, that's really going to help reduce the spread, including any variants that may emerge.
Anything else you'd like to say, Dr. Cummings, before we let you go?
Yes, please, if you are eligible to get a vaccine, please get it. There is still a group that are ineligible, those children who are 5 years of age or less. And so we all need to do our part to protect those who are vulnerable. So please get any current authorized vaccine will offer protection against any variants that emerge. It's better than nothing. So please get vaccinated.
Okay, Dr. Cummings, we appreciate your time. Thanks so much for joining us.
Thanks, Peter. Thanks for having me.